This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. What is a death doula? I think that that's a good transition into, like what do you work, do you work alongside patients, or are you more of a resource? Do you work a lot of inpatient? Do you do hospice, outpatient? What does that look like?
Yes. And I really, I think that you will find, if you kind of survey the industry of death doulas, is that people practice this work in many different ways. It looks very different depending on who's practicing and where they trained. There's not any sort of like national regulatory or certifying or credentialing body that's really regulating this industry.
Okay.
Which is a big can of worms that I'm not going to unpack right now, but there's really good things about that, and there's really challenging things about that. But anyways, so I will just speak about the word doula. The etymology of that is essentially a woman's servant. You may be familiar with a birth doula. That's someone who walks beside a pregnant person, their family, their care team, and helps the pregnant person to orient towards what their care plan is, how they want this experience to go, how they don't want it to go, and, supports them as they need to pivot when, changes come up. And they might support that person throughout. They might be part of the postpartum journey as well. And so as a death doula, I essentially do the same. I support dying people. I support people who are at the end of life, or who are really just starting to contemplate it. And, maybe I worked with a 20-year-old once who was like, my mom has had a couple of, close calls with her health, and I'm so terrified of death. I want to start dealing with that now. A lot of the work that I do is around helping people figure out what they want their advanced care planning to look like. We can talk about what their legacy is. We can kind of work through those developmental milestones of the end of life, and just help them orient themselves to this kind of landscape of uncertainty.
Yeah. I love the gap that you fill, like just being a resource to have those difficult conversations, making a space for somebody to ask those so immensely important questions that your mom asked you, just being a soft place to talk about those things. I mean, it's an amazing skill to be able to teach people how to have those conversations.